Dermatomyositis is a rare but serious condition that affects both the muscles and the skin. It can cause muscle weakness, pain, and unusual skin rashes that often help doctors make the diagnosis. In a study of 52 patients with dermatomyositis, researchers found a range of skin symptoms. Let's go over the 7 most common signs first, then explore what causes the disease. Skin lesions happened in 100% of patients, which shows how important skin symptoms are in diagnosing this condition. The rash associated with this disease is a red or purple rash that usually shows up on sun-exposed areas. A shawl sign happened in 80.8%. This rash appears across the shoulders and upper back, like the shape of a shawl, and is often triggered or worsened by sun exposure. Heliotrope rash is the second type of symptom, and it is in 75%. This is a purplish rash that develops around the eyes, often with swelling of the eyelids. Lymphedema is the third most common symptom and was present in 34.6%. This swelling and inflammation in the limbs can make movement more difficult. Alopecia or hair loss is seen in 19.2% of patients with this condition. Skin ulcers are the fifth sign, and it affects about 17.3% of patients. These are painful open sores on the skin that happen in severe cases. Calcinosis is sixth on the list, and it is seen in 9.6% of patients. This involves the formation of small, hard lumps of calcium under the skin. This condition usually happens in chronic or long-lasting cases, and it is more common in children. Panniculitis is number 7, and it is experienced by 7.7% of patients. This means that there is the inflammation of the fat layer under the skin. This inflammation of the subcutaneous fat causes painful bumps or swelling, especially in the thighs and arms. Doctors believe that this disease is caused by the immune system attacking the body's own cells by mistake. The most widely accepted explanation is that small blood vessels in the skin and muscles get damaged. This condition is called microangiopathy, and it reduces blood flow, leading to injury in those tissues. Other factors may also play a role. Genetics: if autoimmune diseases run in your family, your risk may be higher. Sun exposure and ultraviolet rays from the sun can worsen rashes. In adults, this disease can sometimes be the first sign of an underlying cancer. This is called perineoplastic dermatomyositis. Doctors often screen for cancer in patients affected, especially if they test positive for certain autoantibodies. Remember to talk to your doctor about cancer screening.